What is the most common primary malignancy of the bone, excluding hematopoietic malignancies? A. Osteoid osteoma. B. Fibrosarcoma. C. Ewing's sarcoma. D. Osteosarcoma. The answer is D. Osteosarcoma. Osteosarcoma is the most common primary malignancy of bone, excluding hematopoietic malignancies, making up approximately 20% of all primary bone cancers. Fibrosarcoma and Ewing's sarcoma are relatively rare conditions, and osteoid osteomas are as non-malignant. About 75% of osteosarcomas occur in what region? A. The upper arm. B. The distal femur or around the knee. C. The pelvis. D. The thoracic spine. The answer is B. The distal femur or around the knee. Roughly 75% of osteosarcomas occur in the distal femur or around the knee. The next most common site is the upper arm. Spinal or pelvic involvement are rare. The majority of osteosarcomas occur in what age group? A. Individuals over 65 years of age. B. Preteens and adolescents. C. Middle age. D. Children under 10. The answer is B. Preteens and adolescents. The majority of cases of osteosarcoma are in children and adolescents between the age of 10 and 25. It's the most common type of bone cancer in children and young adults, and the third most common cancer in teens. Which of the following is a neurological movement disorder typified by sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain? A. Geniospasm. B. Dystonia. C. Bulismus. D. Torticollis. The answer is B. Dystonia. Dystonia is a condition of sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain. Torticollis is a form of dystonia specific to the muscles of the neck. Bulismus is a condition of rapid, violent involuntary motions. Geniospasm is specific to the mentalis muscle, causing involuntary movements of the jaw. A 35-year-old male client presents to the emergency department after sustaining a severe tibial fracture to the left leg. The nurse is assessing the injury for possible complications including compartment syndrome. All of the following interventions would be appropriate to compartment syndrome except dash. A. Assess the bandage applied, loosen if necessary. B. Assess urine output for dark smoky urine. C. Elevate the injured limb and apply ice packs. D. Notify the physician if no peripheral pulses are detected. E. Assess for paresthesis, pallor, and pain in the left lower leg. The answer is C. Elevate the injured limb and apply ice packs. Elevation of the limb above the heart may slow arterial perfusion and raise venous pressure, and worsen circulation. Ice may cause vasoconstriction and further lead to circulation compromise. Both of these interventions would not be appropriate for compartment syndrome. Know the 6 P's of compartment syndrome: pallor, pain on passive movement, paresthesia, paralysis, pulses, pressure. All of these may be present in compartment syndrome. Pulselessness is an ominous sign of impending permanent damage. The physician should be notified. Muscle damage can lead to myoglobinemia of the blood, thereby damaging the kidneys, leading to rhabdomyolysis and dark urine. A tight bandage could further increase the pressure in the compartment and should be loosened if this is so.